My name is Troy Foster. I'm an emergency physician practicing in Illinois in the Midwest, board certified, and every day I see patients that come to the emergency department with severe illnesses. They have insurance, many of them do not, and besides being very scared that they have a new or a newly diagnosed significant illness or maybe an exacerbation of a pre-existing condition, they're very frightened. But they're also very scared of the bill they're going to get and how much money they may be spending of their own, of their college fund for their children, of their savings, of money that don't even have yet, of their future earnings, and how this medical illness that has already compromised their life is going to impact their financial well-being also. A fairly well-to-do family that came in, a young man, maybe in his mid-40s, who had a heart attack. He came in with that heart attack. Him and his wife were not crying about his potential death or disability from the damage to his heart. They were asking me and concerned about how much the bill was going to be and what were the options. The obvious answer to me was to get an angiogram and get this fixed, especially this young, previously healthy man. But they were very focused and tearful, crying about the costs. Of course, I'm sure the stress of finding out you're having a heart attack compounded it, but they were imagining their life savings disappearing from this. And they had insurance, just not 100% coverage. When you have testing you're trying to order, patients will want to try to clear the study that you're going to do with their insurance, and that's very understandable from their standpoint. They're trying to prevent their financial well-being. On the other hand, a lot of illnesses and conditions are time sensitive, and you can't be on the phone with an insurance company for half an hour trying to track someone down, especially in the middle of the night, to approve a medical procedure. Just advise the patient this is what needs to be done. And it's, to me, a little alarming because I may be giving a large bill to a patient and I'm not the one who has to pay it. I'm feeling very concerned for them and their financial well-being, but yet I have to weigh the medical impact if they do have this significant condition that I'm trying to rule out with whatever test we may order. We get a lot of primary care type patients because they don't have any primary care coverage. I had a 50-year-old woman who came in with a breast mass, something that could have been picked up in an office. She did not have, she actually had insurance but had not been able to get in to see a physician, and was found to have a large breast mass that turned out to be cancerous. And had she had regular physician contact, that meeting with me when I was pretty convinced she had breast cancer may have been prevented. This may have been picked up much earlier when it was at a treatable stage, and at the point where she was at, it was not treatable anymore. many issues with high blood pressure, diabetes. These are, of course, illnesses that do at times require emergency room care, but if they're treated with medications on under a primary care physician's monitoring or close monitoring, then they often don't need to go to the emergency department. And but what prevents that happening is they don't have insurance to see a primary care physician, or their insurance won't cover primary care visits.
I created a website about 6 months ago because I felt that there was a need to help patients who had either no insurance, or like many of my patients, they have insurance, but it just doesn't cover very much. I was inspired by a handful of patients. Well, I use these as examples because they really represent many others. The second patient is a young woman who came in because she had an unplanned pregnancy, and this was something that she and I had actually been through before, and she had gotten on birth control. But I believe her employer changed policies, and the new policy didn't cover birth control, and the method that she was on cost about $50 a month, and she couldn't afford it, so she didn't get it, and she got pregnant again. And she ended up, she was working and going to school, and she had to drop out of school, and now she has 2 children.